So I'm going to introduce some resources that can be really helpful when you're planning, designing your study, or preparing those request materials for a CMS data use agreement, but then also later when you're working on your analysis and you're trying to kind of figure out what's going on. So here's an overview of what I'll be discussing. Again, Medicaid's a joint federal-state program, so you can learn a lot about the national program and what's required under mandatory coverage, looking at national resources or program descriptions. But then since states administer, there's a ton of state-specific details. So I'm going to also cover some resources that you can use to learn more about state administration of the program, choices that have been made, that essential context for really interpreting the data. Besides those higher level program descriptions, I'll move into some resources you can use to find summary statistics, kind of publicly available information before you get into the claims and enrollment level data. And then the second half or last third of the presentation, I'll talk about resources for the research identifiable files, and those are split into MAX and TAF resources. So starting with national program information, there are lots of resources on the national requirements for Medicaid available through CMS and Medicaid, as you might have guessed. And then I'll also introduce a couple of other organizations that I look to for information, and from our earlier segments, I know others at ResDAC use information posted from KFF and MacPac too. So Medicaid.gov, like I said, can be used to learn a lot, and it's going to seem a little boring, but I'm going to walk through the main pages that I think can be useful for research studies. And honestly, I feel like Google gets harder to use by the day, so hopefully I can pull out kind of those topics or resources that are maybe hidden within Medicaid.gov. The first landing page or tab I wanted to talk about is Federal Policy Guidance. And this is a search page that hosts a variety of guidance provided by CMS for the purpose of program implementation. And they're sorted into types. There are regulations, bulletins, different kinds of letters, frequently asked questions that have all been issued by CMS to facilitate how states are implementing what's been federally approved. And they can cover a variety of topics. There's kind of service-specific information, program information, maybe more evaluation. So you can kind of filter your topics. There's managed care, dual eligibles, Medicaid, Medicare, and quality of care. So a takeaway is if you're looking for the supporting documentation to explain federal changes, this could be a good resource. Similarly, there's a dedicated page for state resources, and these tend to be focused on special topics. So I'm not going to review all of the policy and program topics, but I think this can be really helpful if you're trying to identify current interest areas or issues. What is CMS interested in? What's Medicaid looking at right now? What are issues going on with the Medicaid program? So I'll call out a few that kind of are indicative of that. If you select the Innovation Accelerator program, this describes a Center for Medicaid and CHIP Service, Center for Medicaid and Medicaid Innovation, those two offices collaborating from 2014 to 2020, where they were working on a program focusing on reforms in 4 program areas: substance use, complex care needs, high-cost beneficiaries, value-based payments for home and community-based services, supporting physical and mental health integration. So you can see what special programs are going on within the Medicaid program kind of by looking at these. 2 similar pages I wanted to highlight were the Disaster Response Toolkit in COVID-19. So you can kind of see what's going on, maybe with a quicker turnaround, what flexibilities are in place based on what's been going on. And we talked about the expiration of continuous enrollment in 2023. All of the instructions that CMS was providing to states for that unwinding process can be found here. So that can be a helpful resource to kind of interpret what's going on in the 2023 data when we can start using it. So if you're looking for information on special programs and their implementation from a state perspective, this is a good place to look. There's also a lot of program specific information split into these 2 pages, Medicaid and CHIP. And I'm not going to go into detail on all of these, but there's just a lot. So you should definitely look if there's something you're interested in specifically. I tried to categorize or come up with a hierarchy for everything that's listed in programs and policy topics, but I couldn't really figure out the system. There's general program administration information, so it covers enrollment strategies, eligibility, and managed care. And then there's also specific service type pages. So there's coverage on prescription drugs, long-term services and supports, home and community-based services. So if any of these are relevant to your work or something you're interested in specifically, you should definitely look. Just one of the first links under access to care, there's information on the new final rule ensuring access to Medicaid services, which takes a comprehensive approach to addressing health equity, including access to care. And then that has the final rule, and then the proposed rule, corresponding fact sheets, the original request for information. So kind of this archive of what's been going on while CMS is implementing a new rule. And I know this has been listed as a topic for a long time, but the resources are specific to this new rule. So if you ever find something, I definitely recommend saving it, because the website does change over time and the timing of the Internet Archive might not capture what you're interested in. Some very important resources on this Medicaid page include state plan amendments. So there's a resource where you can look at all state plan amendments that have been submitted for CMS review and approval. This is also where you can find waivers with the Section 1115 demonstrations with background information on what those are, and then the actual submissions with descriptions and status information. And then a few other resources I'd like to draw your attention to on this Medicaid page, because they're a little hard to find again. Under quality of care, you can go to performance management, and that hosts child and adult core sets. So this is a program where they've been tracking quality of care for beneficiaries, monitoring state performance, thinking about improving quality of care. This was previously voluntary, but as of fiscal year 2024, it's required. And the summary information tied to that can be really informative. Another topic includes financial management. If you select state budget and expenditure reporting, you can actually access the Medicaid budget and expenditure system, or MBES resources. And that includes MBES expenditure reports from the form CMS 64. That's a statement of expenditures for which states are entitled to reimbursement. So it's reconciling what's been submitted and filed and then approved. So there are financial management report data from 1997 to 2023 that include a lot of summary information that can be useful. And then finally, one of the topics on Medicaid is data and systems. And that includes Medicaid and CHIP Business Information Solutions, or MACBIS, which hosts all of the T-MSIS resources and then the TAF RIF specific resources. For CHIP, this is very similar to that Medicaid page where there's a mix of information by topic, program, and benefit, but it is CHIP specific. So like Medicaid, there are enrollment reports and expenditure reports from the CMS 21, the CHIP equivalent of the CMS 64. I would strongly recommend looking at that CHIP state program information if you're learning about CHIP. We've already talked about how there are different approaches in design, whether it's Medicaid expansion, separate CHIP, or a combination. So this includes those descriptions by state, so you can see what states have implemented for their CHIP programs. And then the last group of resources on Medicaid.gov I'll cover fall under state overviews. And there's the Medicaid and CHIP scorecard, and then state Medicaid and CHIP profiles. Starting with the profiles, these have summaries of eligibility with eligibility levels for different groups, enrollment information with some summary and national comparisons, and then quality information pulled from the child and adult core set measures that I mentioned, and then corresponding program documents. So this is another route for obtaining state plan amendments, demonstration, and waivers specific to a state. So if you're looking at just specific state programs, you can get a lot of information by pulling them from this profile page. Medicaid and CHIP scorecard is designed to improve transparency about administration and outcomes of the Medicaid program. So this actually has a bunch of measures in different content areas. There's program characteristics, highlighting variations in care delivery, data to support program improvement, eligibility and enrollment and expenditures, as well as healthcare quality performance and federal and state program administration. And I think the scorecard has a lot of potential for use. So kind of preliminarily, measures can identify areas of interest. Again, what's going on in the program, what's a focus right now in program administration or policy. And then you can also see there's a lot of summary information that gets used to create these measures. So you can get a lot of summary data to help kind of understand what's going on and the impact of these programs just in the scorecard without going into the claims level data. I have a couple other resources for this national program information. So first I'll be talking about Kaiser Family Foundation, or KFF. If you go through what KFF's done to provide information on the Medicaid program, they cite a ton of resources. So there's information from CMS and Medicaid.gov, but also Urban Institute, the National Committee for Quality Assurance, MACPAC, CDC prevention status reports, and then KFF also conducts an annual state Medicaid budget survey where they're interviewing Medicaid directors and they pull information from those annual surveys and put them in a report, and that can be really helpful. So I think KFF does a lot of good work summarizing or synthesizing information and keeping track of what's going on in kind of the landscape. So there's a general Medicaid page on KFF, and you can find a variety of resource types. There's kind of research topics, background reports, where there's a literature review and reporting information. There's also tracking of waivers and policies, and then information that's been collected from surveys or other things that they've been working on. Something else on this general Medicaid page includes 10 things to know about Medicaid basic resource, which I point new TAs to. And then separately from the Medicaid page, there's also a state health facts resource on KFF, and I think we pulled some information from this in earlier presentations, but the state health facts includes many different health indicators summarized at the state level, and Medicaid's a category you can select for these indicators. And here they've consolidated a lot of information, made it super user-friendly, summarized things, so you can figure out what's going on without going to all of these different resources. And I looked, I think there are 212 indicators or something that get split into 50 categories. There's kind of the information you'd expect: total enrollment, monthly enrollment by state, spending, tracking of waivers again. But there's also some really interesting stuff, including a market tracker for managed care organizations, stuff that you might not expect to be as readily available or as well synthesized. I talked about the CHIP program information available on Medicaid.gov, but here it's in a nice table, so you can choose which is the most useful when you're doing your project. The final resource I'm highlighting for National Medicaid Program information is MACPAC. And the Medicaid and CHIP Payment and Access Commission is a nonpartisan legislative branch agency that provides policy and data analysis and makes recommendations to Congress, the Secretary of the U.S. Department of Health and Human Services, and the states on a wide array of issues affecting Medicaid and CHIP. So within their authorizing statute, their areas for analysis include payment, eligibility, enrollment and retention, coverage, access to care, quality of care, and the program's interaction with Medicare and the healthcare system generally. And they've also done a lot of work to provide kind of a synthesis of information. I'll go through a few items that can be useful. Medicaid 101 is another great explainer with some more detailed subtopics, and I said that I point people to the KFF resource, but I think this is the first thing I ask ResDAC TAs to read in week 7 of new staff training, where we talk about Medicaid. So a lot of information in that. The site also has information listed by topic, so you can select any of these for more information. Again, there's a mixture of kind of services or more general topics like eligibility, health equity. And then within publications, there's a range of resource types. I wanted to note one in particular. MaxStats is now found within publications. I think previously it was a standalone page, but the MaxStats get updated as information become available. And this is similar to some of the other resources I was just describing, where they're synthesizing or looking at multiple sources to create a summary. So there are these tables that get updated continuously, and then they do create an annual printable data book. So the current one's posted here, and then there's an archive from 2011 to 2022. So you can get a lot of summary, trend information, changes over time, a picture of what's going on in Medicaid for over the past decade. Okay, so that was everything I was focused on for kind of high level program, national, federal Medicaid information. But as we've emphasized, it's really important to understand how states are administering the program. And I already talked about Medicaid.gov, but this is a place you can look to for an overview of waiver types, access to descriptions of state-specific waivers, a profile of state Medicaid programs. Again, you can pull program documents by looking at a state. So this can be a helpful resource when you're doing that kind of legwork to understand what's going on and who's included and what's included. And I'm also going back to KFF. They have some state-specific resources. The waiver tracker has already come up. I know it was shared in chat earlier today. I think this format might be user-friendly compared to Medicaid.gov. I also like that it pulls key themes. It's synthesizing or summarizing what's going on. So right now they're looking at eligibility expansions, benefit expansions, particularly in behavioral health, provisions related to social determinants of health. So it's interesting to see kind of what's going on beyond just here's what Medicaid.gov has available. And then KFF also has state fact sheets. You can select a state for summary information on enrollment, eligibility, expansion status, some basic demographic information, expenditures by enrollee type and service, that FMAP, federal state share information, summaries of some utilization type, like what proportion of births in each state are covered by Medicaid. And then the last resource I wanted to highlight that can be used to help understand states is each state's Medicaid agency. I don't have a specific one that I wanted to call out, but a requirement of Medicaid is to have an agency administer the program, and all states treat this differently. So some of them will have a lot of publicly available information. You can get summary data, you can obtain data from the state. Finding out what's going on will really depend on what each state has available, but definitely something to look into. So in addition to those kind of high-level program descriptions, I wanted to talk about some summary data, reports, publicly available information that summarizes what's going on in the Medicaid program. So besides those things I listed already, just at a high level, Medicaid public use files generally only have geographic data summarized at the state level. They don't go to a smaller scale. Any summary of utilizations in kind of a broad category, whether that's enrollment group or type of service, nothing's too specific. And going along with that, there isn't diagnosis or procedure level data. You might be familiar with Medicare. It sounds like a lot of you have worked with Medicare administrative data. Some of those public use files have payment summaries that are at the DRG and physician level or procedure and physician level, but there aren't any equivalent Medicaid public use files. And this is a pretty big change from when I last presented this segment, but there's now data.medicaid.gov that hosts Medicaid public use files. And this divides the public use files into groups: drug pricing and payment, enrollment, quality, eligibility, unwinding, and state drug utilization. If you look at any of these, they're generally created because they're related to some program of interest, something that someone is looking into. So if you pull up drug pricing and payment, there's information related to national average drug acquisition cost. There's also the drug rebate program and whether manufacturer price has to be reported as part of that program. So that's the kind of summary information that gets reported. Those MBES reports from the CMS 64 can be found here. There's also some eligibility information that gets derived from T-MSIS and data quality reports. So I think this will continue to grow over time. So keep looking at this page to see what's getting added. One of the files, state drug utilization, is probably one of the long-standing Medicaid public use files. It's also on Medicaid.gov. It records drug utilization with number of prescriptions, dollars reimbursed by state and by year by NDC. So you can get a lot of summary pharmacy drug information for Medicaid. I don't think there's an equivalent file for any of the other service types, but it's nice if you are interested in drug utilization in the Medicaid program. Another resource for statistics are reports and summaries that were created from the CMS RIF or the source of the CMS RIF. And I maintain this page. A lot of these are more historical, but I think that history might be of interest. It's a little unique for public files to have that date range going back to 1975. So there are MACS chart books for 2002 to 2013. These have summary information by state, kind of an overview of optional benefits by state, enrollees as a percentage of state population, percent enrolled for a year, total person's year of enrollment. It's just one alternative format to get that information. The CMS Medicare Medicaid statistical supplement is now in an archive on the CMS site, but it's still available. It has information aggregated into broad types of service and demographic characteristics. And again, I think what differentiates it is those trend tables that go back a few decades. And then the last item is MSIS data tables. These cover fiscal year 1999 to 2012. Again, there's not much in here that's different. There's enrollment and utilization, but the format's an Excel file. So sometimes that's useful compared to a PDF. Okay, so for the next part, or like the second half of this presentation, I'll be talking more about the research identifiable file resources. CMS hosts all the materials related to the Medicaid Analytic Extract, or the MACS data, that format from 1999 to around 2015, depending on the state. The data documentation for MACS are downloadable by year. So each year has its own set of data documentation where you get data dictionaries. You actually get record counts within that documentation. There are variable crosswalks that cover changes from year to year. There are also crosswalks that describe waivers and managed care plan characteristics and taxonomize home and community-based services. So there's a lot of information in the data documentation that you might not see if you're used to looking at like CCW's record layouts only. Within the documentation, there are also anomaly reports. These are created when the MACS files were created, and I'll talk a little bit more about this when I talk about the validation reports next. But pretty much they flagged unexpected low or high numbers for enrollment in services for each year of the MACS data. And then the last resource for MACS general info I wanted to highlight is frequently asked questions. They have a 62-page document that covers frequently asked questions about MACS, and every once in a while I still look at it because I still get questions about MACS, and there's a lot in there. And MACS validation, I think Nate mentioned this at the beginning of the presentation, but this is the equivalent of the data quality atlas, but for MACS, the older format TAF, or the older format Medicaid research identifiable files. So these validation reports information by state and year, and they do have a lot of background statistics or record counts. So you can get a lot of information before you design your project to see how many records are available and how many beneficiaries or enrollees are included in the MACS data per year. So they're definitely an invaluable resource. These are organized by state, by year range, and a lot of the validation happens when years are compared. So it's kind of a within state annual comparison to look at expected values, whether something fell into an expected value or not. So there's summary of utilization, split into claims and encounter, looking at completion information, as well as personal summary with summary utilization information, as well as some summary demographic information. So definitely worth looking into before your project is underway to decide if MACS will be useful for your study, and that can also be helpful to verify your results if you're using the MACS. And then one last MACS RIF resource type I wanted to bring your attention to on the CMS site is issue briefs. And these can be helpful for understanding areas of interest in well and what's been reviewed in the MACs. And I pulled some examples. It's interesting, I think, to see that a lot of questions we have from the MACs are carried over into the TAF. So there's a big change from MACs to TAF, but that doesn't mean we're not interested in the usability of comprehensive managed care information or linking Medicaid and CHIP over time. So a lot of these things are still relevant, and something that was done in MACs might have some utility even if you're using TAF only. Next, I'm talking about resources for T-MSIS, or the Transformed Medicaid Statistical Information System. T-MSIS support's found on Medicaid.gov, so I mentioned this before, but it's Medicaid, MACBIS, T-MSIS. And this is one of the first places I go to when I receive a question that I can't figure out using the TAF RIF resources. So T-MSIS data guides used to help states map their own state system data to T-MSIS. And I ranked, I think, what's the most helpful for researchers. So there are data elements with specifications where they're listing valid values, related rules, measures with the variable definition, code values, documentation. So the instructions that apply to the T-MSIS data will eventually become what you find in the TAF RIP. So this can be really helpful. I think Sammy mentioned it's around 1,400 records in the data elements in T-MSIS data guide. Data dictionary appendices kind of complement that data element resource where they're explaining coding or taxonomy when state systems data have to get standardized to T-MSIS. So that can be really helpful to understand. If you know what's going on in a state, but the categories in T-MSIS don't quite match, here's where you would go to figure out how a state would have submitted their information. Another resource that can be helpful here is technical instructions or supporting documentation on reporting requirements. This has replaced the T-MSIS coding blog. So we used to talk about the T-MSIS coding blog a lot, and this is the same thing. It's just has a different name. And this describes kind of topics for observed issues. And I also look here because if there's something going on in the TAF RIF, there's a good chance there's background documentation where it's been a known observed issue in the T-MSIS. You can get an idea of when it was addressed or how it was addressed, if there's a good solution or if it's something that's still causing problems, if there are a lot of records in this technical instructions. The T-MSIS data guide also covers validation rules, data quality measures, file segment layouts, stuff more specific to what's getting submitted through T-MSIS. MACBIS TAF hosts resources specific to the TAF RIF, not just T-MSIS. So the TAF technical guidance is posted. I think we already mentioned there's a demographic and eligibility, claims, and a guide to using Illinois data. That's all technical guidance that's posted in multiple places. There's also an introduction to TAF presentation and a resource analogs to MACs that's really helpful if you have experience using MACs data but are new to TAF. There are some resources here that might be helpful. The last time I presented this segment, I think the TAF Data Quality Atlas was brand new. You didn't get much time to delve into it, but since then we've had a lot more experience looking at it. It's definitely become indispensable. Like the MACs validation reports, you definitely should look at this before you set up your study to assess feasibility. So the DQ Atlas assesses the quality of different TAF elements. And I think it's good to think of this as an introduction. There are different views for each assessment. You can look at by topic if you're looking at all states, or a specific state if you want to look at topics for a particular state. So I think most people, I'll talk about topic and state together since they do cover the same topics. So the Data Quality Atlas provides ratings of usability where each state year and data release has a topic that's been rated as high, medium, or low concern, or possibly unclassified or unusable. And each topic has its own methodology for assigning these values. Sometimes it's relying on an external benchmark. Sometimes it's just created from the TAF, but there's a description of how it's done within the TAF data. I definitely recommend reviewing the methodology background to help understand how each assessment is generated. You might have different thresholds for what is a high or medium concern, depending on how important a variable is to your research. So I just listed all the topic areas. And then within each of those areas, there are specific topics. So within linking across files, there's a description of linking claims to beneficiaries, linking expenditures to beneficiaries, linking claims to providers, and linking beneficiaries to managed care plans. That list of topics is comprehensive, but then there's also a way to view by file type. So if you're only interested in a specific service, you can kind of pull all the relevant topics for that specific service type. I'm just looking at one example. I pulled the first topic, linking claims to beneficiaries for 2021 release 1. If you look at the background or methodology for this document, it explains that it looks at the proportion of service use records in TAF and how many of those link to eligibility records using the MSIS ID. And if you pull up that background document, there's a little bit of a narrative. There's a description that covers possible causes. I think we've been talking about this, but one of their possible causes is there's a chance that due to retroactive eligibility, someone's eligibility start date doesn't line up with the actual utilization record. Or another thing is presumptive eligibility. Sometimes that didn't result in enrollment in the month. They do say it's probably not denied claims since those get excluded for TAF. So there's a lot of information in that background document. They also walk through the methods. They identified encounters in fee-for-service claims, selected non-dummy TAF DE records, matched that utilization header from the utilization record to the eligibility record, looking for a same month match. And then they categorized based on how many didn't match. And there's kind of percentages for what they categorize as low, medium, or high concern. I think people are pretty familiar with that map view where everything's nicely color-coded. You can click on a state for a summary, but I did want to point out that there's this table view, and I like the table view. It has the same information, but it has that detail really readily available. So if you want to see the numbers that contributed to the rating, I think it's good to look at that table view. And you can also kind of maybe decide if that assessment level matches what you're working on. A couple of additional final notes about the data quality atlas. One thing to be aware of is that this is created from the TAF data, not the TAF RIF. Sammy talked about this, but it's kind of that preliminary step between T-MSIS and the data that you would access. You should definitely be reviewing the RIF documentation along with the DQ atlas to make sure that something's available in the data. So there are topics that describe encounter payment data in DQ atlas, but we know they're redacted from the RIF. So it's good to compare the RIF resources to what you see in DQ atlas. And then I also want to note that besides the methodology to understand how assessments are generated, it can be really helpful to look at those resources because there can be recommendations for observed issues. I looked at the bundled payment for prenatal care topic, and it says if you're looking for prenatal services where there's a bundled payment code where a delivery code covers prenatal services, that can be an issue if you're trying to track volume of prenatal care. There won't be distinct claim records or utilization records for those services. So they suggest linking, looking at other data. Maybe TAF aren't a good fit. Maybe you want to look at EHR or excluding those if you're really interested in kind of total volume of care for cases where deliveries are coded with bundled payment. So I think we've mentioned it, but this is just a really comprehensive resource. It's very, very informative. You can get summary statistics as well as information on data quality. Besides that, the bulk of the DQ atlas with actual assessments by topic, there are some analytic briefs. They're newly split into their own page. There's additional documentation, analyses, and method recommendations sorted into research methods and data quality. So you can see what's being studied, what are kind of current issues. Some examples include final action status and claims. I think we pulled that for an earlier segment today. And then TAF DQ Atlas also has really thorough support information. So definitely look at About DQ Atlas if you're trying to use DQ Atlas and you don't know what's going on. There's resources for understanding and using. There are also descriptions that cover timing of RIF that can be kind of complicated with that release schedule. And then finally, I do want to cover some TAF RIF resources from CMS contractors that are involved in the RIF request process and the distribution process. I'll start with CCW, the data distributor. CCW has RIF support resources posted on their site. There are summary statistics that have been created using the research identifiable files. These are really up to date for Medicare. Right now, I think they're available just for MACs, not for TAF. Tomorrow, I'll talk more about a pricing tool, but this can be used for a simple query of select TAF variables from 1 year of TAF data. So you can actually get some preliminary count information for a specific cohort or group of enrollees using the CCW pricing tool, and that can be really helpful. CCW hosts the TAF RIF documentation, so they have record layout and code books for the TAF RIF, as well as record layouts for the MACs data. CCW has helpful analytic guidance, including user guides for MACs and TAF. The TAF and MACs user guides both walk through the assignment process for beneficiary ID. I know that led to a lot of questions today, so I think their description could be really helpful. Normally it's like in the first or second section of a user guide to explain the process they use to assign a Benny ID to an enrollee. And then along with those user guides and technical guidance, there are white papers. These are also created just from MACs, but I think they're still useful. There's one that describes evaluating emergency department utilization in MACs, and I look at it. And then there's also a description of evaluating encounter data completeness in MACs that I've referenced pretty recently. So again, a lot of these MACs resources do have relevance in maybe a more recent TAF focused world. And then the last resource I'll talk about is ResDAC. So the ResDAC site hosts a lot of TAF support resources. We have file overviews and data documentation for the research identifiable files. We also kind of post duplicates of the TAF specific resources that we talked about, the TAF technical documentation. There's a link to the DQ Atlas. We want to make sure everyone can access these things, so they're kind of posted in multiple places. We have a knowledge base with articles that describe using Medicare and Medicaid data. We don't have as many for TAF at this time. There's one that describes service tracking claims that might be useful. There are some that talk about identifying dual eligibles, identifying managed care enrollees and MACs. Keep an eye out. I know the analyst team's been working on articles that are awaiting CMS approval. So this is something we want to keep working on and expanding. The ResDAC site's also the place to look for general CMS research identifiable file request information. We post data release policies, updates, announcements. Those are generally on our site. We have all the file availability information, so information on what can be requested and when is on our site. And then all of the data request materials for a new study or for submitting an amendment to modify an existing project. All of that can be found on our site. We have a help desk that's staffed by technical advisors like me. There's someone on phones from 8 to 4 Central Time, so you can call us and talk to a technical advisor, or we can answer questions via email.